I think we need to state the fact that a decision will be made, and it will be made by the board of directors when they believe they've got the fulsome data available for them to make that decision, and it may not meet the expectations of everyone out in the community.
Former Huntsville Mayor Hugh McKenzie and former Huntsville Town Councillor Tim Withey have been calling on the community for the last few weeks to get involved in the discussions around the future of health care. They feel all decisions are being made behind closed doors. They say one possible scenario could see all surgeries moved to Bracebridge.
We've been doing master planning, master programming work here at the hospital all around planning for future generations. And in that process, we're looking at a hybrid model. And as a result of that, there's a number of ideas that are being tossed around in the room in terms of what services might look like. What we're trying to do in this process is ensure that we continue to have acute care services and emergency services in both communities. One of the things that we are trying to do is maintain some sense of confidentiality in the meetings to allow people the freedom of expression in terms of maybe even thinking about ideas that are way outside the box, and knowing that they can express those ideas in a forum that they're not going to have their names associated with it out in the press or whatever. So we're looking at centers of excellence as a potential. So how do you really look at developing a one hospital type of scenario, but delivering it over 2 sites? So that strong communities, strong healthcare services are available in both of our communities. That's the exercise we're doing right now. We have actually 16 physicians, along with other frontline staff, some members of administration, some members of the board, are working on this hybrid working group. All of it's been above board. Everyone's invited to the same meetings. I can't comment if physicians or other clinicians have met on their own, but in terms of our actual process, it's all being together in one room.
Natalie Bubela says she's hearing the concerns in the community. In fact, she's expected to meet with local mayors this week.
Our hopes are that the hybrid group will come up with some type of an outcome towards the middle to end of February. At that point, we're committed to going out to the public to let them know where we are in the process, and that will involve 2 things. We didn't have the costing available the last time we did our public consultations, so our plan would be to update the community as to where we've been from when we met with them in the fall to where we are today, and then the scenario that we're looking at that may or may not have legs in the future, and invite the public to provide us with some feedback. After all of that comes together, we would then put forward potentially a revised model that would go forward to the board with the appropriate statistics and data that they would require, and we would ask them to make a final decision. Ultimately, what we're looking at is trying to have something available, something that's being put together to submit to the capital branch of the Ministry of Health in the fall.
As for that concern that the community will have little say in the final decision?
I think that's a fair concern in that I could see the public might think that. I think if the public would recall, those that did come to the last community sessions that we had, we did present 5 models at that point and received very good feedback. We invited the public to come back either online or actually submit a hard copy of a questionnaire that we had present at the meetings. And that actually is what has led us to look at a hybrid approach. It has caused us to veer off what we originally looked at to see if there's a different way of coming up with a solution for healthcare for future generations. So I think we've been listening to what our people have told us, and we'll continue to do that.